Hello, everyone. Welcome to the All-Come webinar for Oregon's 1115 Medicaid waiver. This is our September monthly session, and we're so excited to have you here today. I'm going to quickly gloss over the housekeeping because we did that before the recording and get to our agenda. So today we are going to start the same way we always do. We want to make sure we have a shared understanding of what we mean when we're talking about Oregon's 1115 Medicaid waiver and the background of that. We have one major topic today, which is to talk about young adults with special healthcare needs and what this phrase means when we're talking about our Medicaid waiver and how we're doing Medicaid here in Oregon as we look forward. And then we're going to round it out with an opportunity to have an open forum questions and answers and give you just a few pieces of information about what to expect in coming months. I get to turn over, I believe at this point, yes. All right, Steph, take it away.
Thank you, Jessica. Hi, everybody. My name is Steph Jerem. I use she, her pronouns, and I am the 1115 Medicaid Waiver Policy Director. Happy to see you all again. I'm going to start with just our standard background for anyone who may be new. So we'll dive into that. We're here today to talk about the Oregon Health Plan. The Oregon Health Plan is how we refer to Medicaid in Oregon. Medicaid is the nation's public healthcare program. It is free in Oregon healthcare coverage for low-income children, teens, and adults who live in Oregon. Ongoing open enrollment, people can apply at any time during the year. Go to the next slide. There are federal rules for how a state delivers their Medicaid health insurance program. And so we have to follow those, but sometimes the state can ask to change how those rules apply. And so those changes are called a Medicaid waiver, and that is what we're talking about today. There are many waivers. We are talking about the 1115 waiver. This is one that we do every 5 years. And if you go to the next slide, as a reminder, the key changes to Medicaid here is really an expansion of coverage and benefits. And so we've talked in many of our prior sessions about continuous eligibility and enrollment for children up to age 6, so 0 to 6, they remain covered. For everyone else, it's 2 years of continuous eligibility at a time. Those are some expansions from this waiver. We've talked a lot about coverage for health-related social needs supports. So these are new benefits that support individuals with housing, nutrition, and climate supports. What we're talking about today is coverage for young adults with special healthcare needs up to age 26. Another benefit that we've talked about or we will be talking about soon is coverage for a limited set of services for people in a carceral setting, so in jails or prisons, 90 days prior to release. All of these are rolling out at different times based on readiness of the system and state direction. So I'm going to jump in to our next set of kind of what we're focusing on today, which is the young adults with special healthcare needs population. As a reminder, these slides have a lot of words on them. It's a pretty complex topic. And so we try to put as much information on the slides so that you can refer back to them. And I will try to make it easier to understand, but please feel free to use the chat for questions. We do have Max Serenencourt, who is our subject matter expert, who's here today to help answer those questions as well. So if you go to the next slide, what this big change is that starting in January 1st, 2025, OHB is going to offer more benefits to young adults who have qualifying health conditions under this new eligibility category, expanding Medicaid for a longer time period for young adults with special healthcare needs. On the next slide, please. And maybe one more. Words didn't show up. Oh, okay, we're gonna go one by one. There you go, thanks. So these are people who are ages 19 to 25. That's what we have the authority for. In January, we're starting with just the first 2 years, 19 and 20. And it's individuals who live with or are at risk for ongoing conditions, physical, intellectual, or developmental disabilities, long-standing medical conditions, mental health conditions, substance use, or neurodevelopmental conditions. These individuals also can have an income up to 305% of the federal poverty line. And that is the same as what children 0 to 18 have as an income limit. So we're really trying to expand that and help these individuals with the transition between the pediatric care system and the adult care system. YSHCN is what we refer to this. I know that it's a difficult acronym, and so you'll hear YSHCN as the acronym that I'll refer to today. If you go to the next slide, please, we can talk about 2025 in particular. So who qualifies? We're looking at young adults ages 19 and 20. We're starting to roll this out with those who have just aged into this, those who are under 305% of the federal poverty limit and have a healthcare need. So it's that combination of things that would let someone be eligible. Oregon plans and hopes to expand this over time up through age 25 based on funding availability. So these are things that we want to see that we would roll out over time, continue to add additional ages. And we really are excited to be able to support, again, that transition between pediatric care and adult care systems for those who have more interaction with the healthcare system. If you go to the next slide, you may be wondering why we're focusing on these individuals. In Oregon, 1 in 5 children under age 18 has a special healthcare need. And more than 80% of these young adults in the state don't receive the proper tools to care for their health and social needs adequately. And so we really want to focus on these individuals and supporting them. They have more health and health-related social services. They need more than others of the same age. Once young adults with special healthcare needs turn 19, they can often lose their healthcare coverage, but they still have these ongoing conditions and healthcare needs that they had when they were 18. And so we really want to support with that additional time to navigate the transition. Turning 18 is challenging for many of its own reasons. And so we want to make sure that of all the things that drop off, we're not seeing loss of healthcare coverage at that time, and that people have a little bit more time who have special healthcare needs to be able to support those. You go to the next slide. This is where I said it starts to get a little weedy, but just to give you a sense of what we're looking at. So our current eligibility and coverage for people who are 19 to 25 in this blue on the left, it's up to 138% of the federal poverty line. They have EPSDT and enhanced vision and dental benefits up to age 21, and they don't have access to the health-related social needs benefits, so housing, nutrition, climate. You'll see that starting in January, again, starting with age 19 and 20, it will go up to 305% of the federal poverty limit. They will have EPSDT and enhanced vision and dental for that time period, as well as access to HRSN and any other services covered, should they qualify. Next slide will help us with another acronym that's difficult. So EPSDT, this is early and periodic screening, diagnostic, and treatment. This is a federally required benefit. And in Oregon, this is a program that we are newly launching in full for all children and youth under age 21 who are enrolled in Medicaid. This is outside of the prioritized list. And so this is really something that again, helps with collective understanding of the benefits that are offered to young people, and will match with this YSHCN benefit to be able to support them up to age 21. If you go to the next slide, again, I'm going to talk about EPSDT a little bit. I think we've talked about it in the series before, but just in case we haven't, we're going to go into it a little bit. Starting in 2025, the YSHCN, this group of new eligible people, will have this EPSDT coverage until their 26th birthday. Oregon also plans to cover people from ages 21 through 25. As I said, that's subject to funding availability. But there's a lot of support for that, and that is certainly one of our policy goals. If you go to the next slide, I'm gonna spend a couple of slides actually talking about EPSDT, because I think this is another one that's a little bit confusing for folks. So EPSDT supports medically necessary and appropriate services. And those are, again, very specific terms. So medically necessary means that a treatment that's required to prevent, diagnose, or treat a condition, or to support growth, development, and participation in school or work. So a provider might say, you know, a child needs a certain treatment to support their needs, and that is the request. And so again, it's outside of the prioritized list. And then medically appropriate means that the treatment is safe and effective. And so we have an example here. This is also our website if you want to dive in more and understand that. If you go to the next slide, you'll understand why we want to do this. And so early means that you find concerns early for kids. Go to the next slide. Periodic means that children have access to these services to check on children's health at a regularly scheduled basis based on age. We already do that in Oregon. We certainly recommend that. Screening means that, oh, let's go back to screening, please. Sorry, this is a lot. Providing physical, mental, developmental, dental, hearing, vision, and other screening tests to help find those concerns early. So really, we have a lot of efforts in our state to support early screening and continuous screening to ensure that we're finding any concerns early. You go to the next slide. Diagnostic means that you're using appropriate methods to address any health needs or areas of concern. So you're saying, okay, this is what the screening showed. Now we're going to understand what comes next. And what comes next after this would be treatment. So providing appropriate care when and where it is needed. That means care whenever a child is sick or injured. So that's EPSDT. I know that we're using a lot of acronyms today that are not helpful, but EPSDT has launched. YSHCN, our newly launching category, will have access to EPSDT. That's the main connection we wanted to make there. Next slide, please. We wanted to share a little bit about our engagement strategy. And so this has included culturally and linguistically appropriate communications. We've had targeted outreach to historically underserved communities. We've been collaborating with community partners and application assisters to make sure that we're getting the word out, that people feel comfortable explaining about the YSHCN new eligibility category. We've had provider and staff trainings. There have been some multimedia campaigns, and we've been collecting regular feedback from YSHCN members and families through focus groups and other settings. That has helped inform how this policy is rolling out. So you may be wondering what this means for community members. On our next slide, I've given you all the background. So once again, eligible young adults will be enrolled starting January 1st, 2025. It'll be for 19 and 20-year-olds. Once they enroll, young adults will remain eligible until they are 26. Eligibility is reassessed every 2 years. And again, that is subject to available funding, but that is the intent. That's what the authority is for. Next slide. Who are we talking about, you may wonder? So we have about 8,000 young adults that will potentially qualify. There are 16,000 current OHP members that will get these enhanced benefits as well. We will have about 2,500 individuals who meet the intellectual developmental disability pathway for YSHCN. And YSHCN individuals will stay enrolled in OHP for 24 months before redetermination. So this is, I think, a key slide for us to understand the impact of this statewide and the number of young adults who will be accessing these benefits. Next slide. I'm going to get into, this is our last section, and then we'll leave plenty of time for conversation and questions, which I'm sure there may be many. How OHA is going to actually identify these individuals, how partners will identify these individuals if necessary. So talked about this benefit broadly. How are we actually figuring out eligibility? Next slide. There are 4 ways. So we've said 2025 young adults who are 19 and 20 years old, under 305% of the federal poverty limit, and have one of the following health needs. So first, one or more complex chronic medical conditions. And there's a specific way that we will be assessing that. There's the pediatric medical complexity algorithm is what will be used to help understand this. The second way in which someone may qualify based on their health needs is a mental health condition, substance use disorder, or neurodevelopmental condition. The third is an intellectual or developmental disability. And then the fourth is an elevated service need identified through a YSHCN eligibility screening tool. And so this is the first 3, 1, 2, and 3. OHA will actually be able to use our data to identify these people. And you know, if you're becoming age 19 in the next year, we'll know in advance that you would be qualified for YSHCN based on your claims data, based on the data that we have. So we'd be able to just move people on. That fourth category is a more active pathway for people who are maybe returning to Medicaid or didn't know that this was an option and rolled off. So number 4, if you can go to the next slide, is an elevated service need. And so this is a screening tool. Can you go back one, please? Or is that? There you go. Thank you. So anyone who's 17 to 20 and is applying for OHP through our one eligibility system will be asked some screening questions that help determine YSHCN eligibility. And it can be used by young adults or their caregivers. And the really important thing here is that it may include those who don't have a diagnosis yet. In a lot of young adults' experiences, maybe based on trust in the healthcare system, whether or not they've had time to go to screenings, whether or not they've had access to the proper screenings, individuals may actually show that they have this elevated service need and would benefit from longer time with healthcare coverage, even without a diagnosis. And so that's a really important group of people that we want to be able to capture. And this screening tool will help with that. OHA, on the next slide, OHA worked with the Oregon Health and Sciences University. Sorry, forgot that for a second. Oregon Center for Children and Youth with Special Healthcare Needs to develop this tool. And that group coordinated with an advisory group of parents and young adults and behavioral health providers and other clinical providers to review the tool, conducted testing with users in 6 languages to ensure that this tool is accurate and really helpful and clear to people and helps us understand how someone may enter into the young adults with special health care needs. As I said, the tool can be used by young adults with their caregivers, including those who haven't yet had a diagnosis. 2 or more affirmative answers could potentially qualify someone for this additional coverage. And so we are continuing to test this out, and this is being built into the system as we speak. It's really exciting. It's actually the first in the country to try to do some of this screening for young adults to be able to support them with expanded coverage. So exciting, new. This is why we have a waiver. It's a demonstration project to really see what health impacts we can have by providing healthcare coverage to people who have special healthcare needs for a longer time period. And so with that, I think we're going to move to question and answer. And I know I've seen the chat going and I've seen Max answering lots of questions, but if there are any that we think, if anybody wants to raise a question or raise your hand and ask a question, have me repeat anything or go back to slides, happy to do that.
Maybe as a way for us to get started, I'll just read the questions and answers that are in the chat just so that that gets captured for our recording.
Great.
And our first question was, is the income limit for the individual young adult or for the family if living with the family? And the answer is that those are household income limits. So if someone is living with or dependent on family, the family income will be taken into consideration. A related question, if youth are still dependents of or their children, if youth are still dependents, will the income eligibility be based on their parent or family income? And that is similarly, if someone is a dependent on family, then family income is assessed. If someone qualifies as a young adult with special healthcare needs, are they placed in open card or what CCO would they be placed in? Are young adults with special healthcare needs members once enrolled? I'm actually intrigued in this because I know just enough to be dangerous on this. I imagine the enrollment rules are very similar to anyone else on OHP, but I want to double check. So I think if someone would otherwise, as an OHP member, be on a CCO, they would be on a CCO and they get to choose in their region. If someone would have one of those exemptions or reasons why someone would stay on open card or have choice, then they would continue to have that choice. And so YSHCN is unlikely to change someone's open card or CCO options in and of itself. I saw a thumbs up, so I think I'm not speaking out of turn, but I want to pause and make sure. Okay, and we'll also, I'm realizing this is a good time for me to say, I'm going to absolutely make sure. So we'll check outside of this meeting as well. But I do believe YSHCN, Young Adults with Special Healthcare Needs, trying not to rely on acronyms. They would have the same enrollment abilities as anyone else on OHP. And YSHCN is Young Adults with Special Healthcare Needs. The A is silent, and you will hear us use that acronym a lot because it is a mouthful. Okay, now we're getting into some questions that have not yet been answered. How will young adults with special healthcare needs access the HRSN benefits For example, if they're in need of housing supports, would they be eligible for those in January once YSHCN is effective? And the answer is yes. And then additional context that this assessment for if someone qualifies as a young adult with a special healthcare need is assessed annually for their HRSN needs. Once determined, they access their benefits through the same HRSN health-related social needs programming that everyone else on OHP also accesses those benefits if they're eligible. Where can I find the most updated version of the HRSN guidance document and our additional updates anticipated before the rollout of the housing benefit in November? Staff helpfully put the link directly in the chat and added that no additional updates are anticipated. I do think once we get past the Q&A session, I have a slide that says that we'll be talking more about housing next month. So more information will be shared and we can have that conversation next month, absolutely, right in advance of go live. Okay, I'm just realizing I've set myself up to talk for a lot. I didn't realize I was doing this, but I'm going to keep going. This next question doesn't have an answer, so I'm going to say it and then I'm going to pause and we can see if we have expertise in the room. If they're seeking housing supports for substance use disorder, do they need to be enrolled in treatment services? Can they access housing benefits without treatment if they have a substance use disorder diagnosis? And I do think this sounds like it's enough of an intersection of complicated things that we may need to come back, but I'm going to pause and see if anyone has additional. Yeah, go ahead.
Yeah, what I would say is that kind of my order in which I think about this would be, are they on OHP? So first someone would need to qualify for YSHCN. And so substance use disorder would likely qualify someone for YSHCN if they're 19 or 20. And then the housing supports would be if they are currently housed and at risk of losing their housing. So I'm not sure whether or not that would apply for someone who's seeking housing supports for substance use disorder, but I'm not really sure. And so we can talk about that more, or if there's anything you want to, talk through, if that's something that would be helpful. I'm happy to verbally think through it, or we can follow up.
It's a good question. There's a lot that is encapsulated in that question.
Yeah, we do our best to try to create the big picture, but I think in almost every situation, they're unique. And so it's really thinking about how this might apply or that might apply. And so this is a great example of the reality that many of our members face.
Absolutely. All right, I see a couple more questions. Actually, well, okay, I'm going to ask Trevor to pop over to the next two slides and then I'm going to circle back because one of these is an email address and we have that. So upcoming sessions, oh, thank you. I think the best way to make sure that information gets to us that then gets to the right subject matter expertise and gets to the right people internally is to use this 1115 waiver.renewal at odhsoha.oregon.gov. So that's going to be the best way to get multiple eyes on it, and is always a great option if you have either a very specific question or a broad one about something that you're trying to find. We do have a bunch of stuff on our website. You'll see the oregon.gov/1115 waiver renewal is a URL that'll get you to the main page. And there's now quite a bit of other materials up there and linking sites as well. We do have a external, we have a newsletter that comes out pretty regularly. And so want to call that out as well. And then Thank you for being flexible, Trevor. Could we work backwards now to the slide before, and then we'll get back to Q&A. I just wanted to make sure I got through all that before we close. And even though we have some time, just to show us all that we do have plans for some specific topics for the next 2 months. October 9th is our next All-Come webinar, and we'll be talking about health-related social needs, housing, and outreach and engagement services specifically, and that's right in advance of that next go live, which is at the beginning of November. And then we have a benefits update project. You'll see BUP as an acronym that we'll try to not to lean too heavily on, but you might see pop up in November, which is just a reminder that this round of the 1115 waiver has so many different components, and we want to make sure that we are continuing to give updates across as many of them as possible. And now I can roll us back to the Q&A. I just wanted to make sure that we were grounded in those last two pieces. Yeah, sorry for asking you to jump all over this PowerPoint, but you're doing a great job. Oh, and I also see that if there's a specific young adults with special healthcare needs question, that Max has offered his direct line as well. And also you're welcome to send to the main inbox and Max if there's something that might have multiple components, since for instance, this one has some HRSN specific components. And circling back. Okay, so there's a question about if young adults with special healthcare needs are categorically eligible for all of the health-related social needs services, or if they need to be a part of a transition population, or there are additional eligibility factors. And I think that this might be another place where we want to make sure we are all, because we have YSHCN expertise here, but perhaps not a full complement of our health-related social needs focused staff. This might be a good thing to clarify at that intersection. Steph, I don't know if you have additional context for this, for the intersection of is being a young adult with a special healthcare need categorically an eligibility factor for all of the health-related social needs services? Or I think there are additional factors, but I am now realizing I might be beyond my depth.
Yeah, there are additional eligibility. So they would have to then be eligible for housing. And so the housing eligibility says you have to be in a home, you have to be at risk of losing that home. Those pieces that would have to apply to YSHCN. They don't just automatically get the HRSN benefit for housing. Does that make sense? And similar would be for nutrition. They have to show that nutritional need and have it be satisfied by the nutritional benefit. So medically tailored meals, for example, starts in January for individuals who have a diagnosis that needs support through medically tailored meals. That would be the type of thing they could qualify for if that was the right thing, but they may not have that need. And so that wouldn't be the right fit.
I believe this is one of those situations where, as you're saying, Steph, everyone's situation is ultimately unique. And so there's this constellation of needs and factors. I don't want to speak out of turn. But I get the feeling that definitely in the context of housing and outreach and engagement services, this is exactly the kind of content we'll be circling back to next month. And so I'm gonna, maybe we can sneak a little bit of young adults with special healthcare needs as it fits into the context of that intersection as well. But I don't want to make promises because there's a whole team of people trying to work really hard to get these updates. So before I go further rogue, I'm going to return to the questions people are asking. I see a few questions, or at least one that is, no, I see a couple that are talking about health-related social needs and the fee schedules. which I think we will need to double check. I don't know, keep putting you on the spot, Steph, but as someone who has one level higher view into things than I do, and you are muted if you're speaking. I can't.
Thank you. Yes, fee schedules have been released. Let me see if I can find them.
Thank you so much.
Yeah.
And a question, is there a guide for HRSN provider CCO enrollment? I've seen the open card guide.
I posted that.
Oh, perfect. And I think that the answer is that things might be slightly different from CCO to CCO. So you do ultimately need to check in with your local CCOs to make sure that I am sure they have tools, guidance, and probably humans to help with that enrollment process within each CCO. But signing up as an open card provider is a great first step also if you want to do that simultaneously to CCO HRSN provider enrollment.
Look at that teamwork. Thank
Look
you.
at all this cool stuff. Sorry, I know for the recording that I need to be saying all these things out loud, but there's so many good things and good conversation happening back and forth. Okay, looks like Eric has pointed to specific parts of documents to look at the fee schedules, which is fantastic. Looks like Max has further clarified eligibility for HRSN services. And I think there is still additional specificity for each service. And then we have a request to go back to the slide that compares young adults with special healthcare needs and benefits. And maybe, Trevor, if you can sort of start to scroll backwards and we can identify which benefits. Think further. On the other side of EPSDT. Oh, let's see. Is it the Y? I'm going to check in and see if we're at the right slide. Right, the right slide,
I think it
Susan?
was maybe the one here. Let me find it. The slide that has now versus future. Slide 14. Other direction.
14.
14. Bison changes in 2025. Keep going. Here you go. I think that's it. The comparison.
Mm.
Was there any question about that that would be helpful for us to talk through more?
Based on some of the conversation, it might be good for us to add, I don't know if it's an asterisk or something that offers a little more clarity around the HRSN line here.
Mm-hmm. Yeah.
I think you can explain the 138% difference from the 305% to the group.
Sure. Let's see how, so these are Medicaid limits nationally. So 138% of the federal poverty line is the Medicaid eligibility based on income for most people. Low income is 138% of the federal poverty line. We can provide links about what that means and how that's determined. That's for anyone who's over age 18 right now. For anyone who's under age 18, they actually have a higher income limit that's intended to support more kids having access to care, knowing that that's a really important time of life to have access. And so kids, it's the Children's Health Insurance Program that's part of Medicaid, go up to 305% of the federal poverty line. What isn't super clear is that in the future, when starting January 1st, for those people who are in YSHCN, their eligibility now at age 19 and 20 will go up to 305%. So we'll have a small group of people who are in YSHCN who will actually have an income limit of 305% instead of 138% at age 19. I don't know if that made it clearer or less clear. Why do they not have existing HRSN benefits? They do if they are on Medicaid. I guess that is kind of confusing on the left.
So am I hearing correctly that if you're already on OHP, then 19 to 25, everyone experiences this slight shift in what their benefits look like, but there's a different question for people who are joining the Oregon Health Plan for the first time. And that's the part where it starts with 19 to 20-year-olds.
Yes. Although I think that's a good point. Actually, I think this is misleading on the bottom left, that they would not have access to HRSN benefits. People would in the same way, but they would have to qualify just through HRSN. There would be nothing that YSHCN helps access.
So I think we have an action item to review this slide and work with our subject matter experts to add some clarity, which, if that was part of what you were prompting us to look at, Susan, I'm so thankful. If that was a side effect that happened naturally, then that's also good.
Oh, that would this is Brooklyn. I just wondered if sometimes excuse me, numbers don't really make sense to us. So if we were to attach, I don't know, $1,000 a month to the 138, and then does that help to clarify what kind of numbers we're talking about here? Because I understand, but a lot of people don't get that the poverty levels can increase, decrease, and so on.
That's a really good point. And I don't want to make up a number because I have to admit, in my past job, knowing these numbers was something that I actually did know because it changes every year.
Of course.
And it changes based on how large your household is. So there's going to be one number for how much income a single adult, for instance, can make. But a family of 4 is another number altogether. So I wish.
And it changed. I just put in the table
Oh, good.
on healthcare.gov with 2023 and 2024 income levels, because it does change. So
Okay.
family of 4, federal poverty limit is around 30,000. And then I can find the 305% as well.
Is this 100% of the federal poverty level, though?
100%, yeah. So I should.
Yeah, there's so much math involved in this that I don't want to do math on the fly and get it wrong. But I do think that's a really great point to put real life example numbers into a tool like this.
It just helps everybody to envision exactly what we're talking about. Otherwise, it's a blank page.
Absolutely. I'm also seeing, yeah, there is a lot of great stuff in the chat.
Yeah, we have, so I'm trying to get the links for the fee schedule. So thank you for that. I also see you're looking for the fee schedule for outreach and engagement. And let me see if we've got those. And sounds like by end of this week, those will be publicly available. So I think drafts have been shared, but for publicly available information that everyone can access, I think that's end of the week. So apologies for misstating that earlier. And then I think Susan, great point, hinting that perhaps that 19 to 25 is between 138 and 300 or 200 would actually be on the Bridge Health Plan. And there is no existing HRSN benefits for them. So maybe we need to, this slide attempts to take something very complicated and clean it up, but we can try to get there. Thank you for everyone who's putting their own Google and information in the chat.
Yeah. I want to thank you, Steph. I know we were prepared to talk about one thing, but we also want to be able to be flexible and address people's concerns and questions across the many different complicated things we're all trying to roll out simultaneously. So I want to thank everyone for their grace and also really thank Steph for being such a good resource, while also acknowledging there are some things we can get better, more clear answers to if we put our heads together and come back to you with more information thoughtfully instead of sort of off the cuff considered as well. And I think something I'm seeing as really central is that intersection between the health related social needs and young adults with special healthcare needs, and really getting some resources together that make it clear. I mean, frankly, for me too, because I know I'm realizing I'm struggling to explain and fully understand how these are interacting.
That's a usual meeting, isn't it? You never know what you're going to get.
Yes. And trying to both be able to give you good updated information while also being open to the things that you all are interested in. That's a great thing to continue to put in the chat. I know we have things that are identified for the next 2 months, but we also are able to build towards your interests, your needs, your questions, your concerns. That's why we have these open spaces, precisely because it's where we meet together that we really make all these really cool concepts real. Which maybe, and I'm realizing I'm over time, so I should stop talking. And instead, I should say, thank you all so much. We can leave this chat open for a couple more minutes to continue to collect things. And we will continue to hold these monthly webinars. I see there's a question, is there an opportunity for feedback? I know we've been collecting feedback and that has been integrated into the fee schedule. So I'm not sure what we will be able to do right away, but anything at all, our inbox that is listed here on the slide is a great place to send feedback of any kind, especially if it's feedback that doesn't fit neatly into spaces that we are making currently. And that's the 1115 waiver.renewal at odhsoha.oregon.gov. Thank you all so much. Thanks for hanging out after 11. And I hope you all have a really great day, week, and month, and we'll see you soon.
Great job. Thank you so much.
Thank you.